Well, good morning, ladies and gentlemen. Welcome to the Health Sciences Centre. My name is Cliff Cullen. I'm the Minister of Justice and Attorney General for the province of Manitoba. Thanks for joining us on this beautiful Manitoba fall morning. Just a couple of quick introductions before I ask the Minister Friesen to come to the podium. First of all, Dr. Sokal is with us this morning. I think Dr. Sokal is going to be available to answer some questions later on. He's our Emergency Department Medical Director. As well, John Lyon, the CEO of the HSC Foundation, is with us this morning as well. Thanks, John, for joining us. A couple of our colleagues from the Manitoba Legislature. We have Andrew Mickelfield from Rossmere. Thanks, Andrew, for joining us. And also Andrew Smith from La Jamodier. Thanks to the two Andrews joining us this morning. So with that, without any further ado, I want to invite the Minister responsible for Health, Seniors and Active Living, Mr. Cameron Friesen, to the podium.
Thank you, Minister Cullen. Good morning, everyone. It is great to be here back on the campus of the Health Sciences Centre here in Winnipeg, joined by my colleagues to make a great announcement. Bonjour tout le monde, c'est un plaisir d'être ici aujourd'hui avec vous, avec mes collègues, pour faire une annonce importante pour tous les Manitobains. Since our government first took office 4 years ago, we've made enormous efforts to modernize mental health and addictions services in our province. Many people remember the title, the Virgo Report. And the Virgo Report was a master report conducted in Manitoba that assessed the state of mental health and addiction services here in this province. And there were many findings that came out of that work. But some of the ones that Manitobans are most familiar with is that report came back to say that we have great people working in mental health and addictions in this province, and we have some great services going on, but our services are highly siloed. They exist quite partitioned from other services. And because of that, people have the danger of falling through the cracks. And the Virgo report said much more had to be done to coordinate the efforts, to make these services coherent, to get everyone on board and steering in the same direction. Manitobans will also remember a report more recently called the Illicit Drug Task Force Report. And they might remember the Community Wellness and Public Safety Alliance report. Those reports also added value, talked about the needs of our communities, talked about the number of Manitobans living with addictions and mental health issues, talking about the gaps that exists in our province for years and years. And so we have read the reports, but more importantly, we are responding. We are taking action. We are implementing changes to improve the lives of Manitobans in many ways. Just a few reminders. We've opened rapid access to addictions medicine clinics, or RAM clinics. These have helped thousands of Manitobans get the help they need, coordinating services, coalescing services around the individual, making the system more responsive, not making the patient wait so long to get the help they need. And I can update all Manitobans today and say that 3,470 Manitobans are now registered and receiving services through RAM, and that's just an incredible thing in our province. We've opened flexible length withdrawal beds in both Winnipeg and Brandon, and these are suitable for patients who are struggling with dangerous drugs like methamphetamines. We have created new residential treatment beds, including dozens of new beds for women right here in the city of Winnipeg and elsewhere. Recently, we announced the development of 70 new supportive housing units so that Manitobans in recovery have a place to go as they transition back in their lives, a place with supports, a place with accountability, a place to point people in a meaningful way in a new direction. And we were proud to announce 50 beds and $2.1 million for this investment. We also recently announced $3.5 million in funding support for the Bruce Oak Recovery Center. That will allow us to have 50 beds there for treatment in Manitoba. Oh, and pardon me, I misspoke. When it came to our 70 supportive recovery housing units, that's not 50, that's much more than 50. So we've also made it easier for Manitobans to access naloxone. And just in June, we actually doubled the number of take-home naloxone kits for people who need them here in Manitoba. We have given out more than 7,000 of these kits since 2017 in the province of Manitoba. We were one of the first provinces to allow paramedics to give olanzapine and other pharmaceuticals to agitated patients who are using meth and who are at risk of suffering psychosis. We've announced almost $38 million of new investments in the past 11 months, including many supports aimed at helping children and youth to have better mental health. We've done a lot in a short time, and we know that there is much more to do. But it brings us to today. It's a beautiful morning in Manitoba. The sun is shining, and so we're pleased to be here. We know that the high volume of patients needing mental health and addiction supports puts pressure. It puts pressure on, of course, individuals and their families and their friends. It puts pressure on our healthcare systems, like the Health Sciences Centre right here. It puts pressure on police resources, and we're pleased to be joined this morning by members of the police. It puts pressure on our communities. And for that reason, I am announcing today on behalf of the Manitoba government a $3.5 million investment to add addictions and mental health services to create safer, more appropriate, more focused care conditions for Manitobans who are suffering with an addiction. C'est pour cette raison que j'annonce aujourd'hui un investissement de 3,5 millions de dollars pour augmenter le personnel de lutte contre les dépendances, la santé mentale et la sécurité afin de créer un service d'urgence plus sécuritaire au Centre des sciences de la santé. It was almost exactly a year ago, probably a year and a month ago. Where's Catherine Girard in this crowd? She would tell me. It was almost exactly that time when our government announced a Safer Streets, Safer Lives action plan. Minister Cullen and I were there. We were joined by the Premier and Minister Stephenson, and that was the rollout of a broad plan that was seeking to do what the Virgo report had said, to create a more connected, a more coherent service to serve Manitobans better when it came to mental health and addictions issues. So I can tell you that the announcement we've just made today allows for the hiring of on-site mental health and addictions physicians and psychiatrists, extends them here for weekends and evenings. Those services were not in place before. Before they were only remote and by phone when it came to weekends and evenings. And now we will have those mental health and addictions physicians and psychiatrists liaising with their emergency department counterparts longer hours. This will create new psychiatric liaison nurse positions to assist in that treatment. It will create new security positions here at Health Sciences Centre, understanding that this is a place where we need to keep patients safe. We need to keep visitors safe. And we need to keep the people who work here safe, because this is a workplace. And I'm very excited to announce that this will additionally create 6 mental health observation beds that will be added here at the Crisis Response Center. These are designed to help us get the ability to get people expeditiously out of the emergency department and into beds. We know from Dr. Sareen and others that when people are suffering from meth, they can sometimes be stabilized between 12 and 24 hours, but sometimes they need longer. And we now have a place for them to go to receive the care they need on a ward as an inpatient. And we are very pleased to have this as part of this announcement. This also establishes new safe seclusion rooms to be added to make sure that we can keep people safe until they can be stabilized. This investment is a first phase of a broader strategy to create a more appropriate and more focused care for mental health and addictions patients as part of our Safer Streets, Safer Lives action plan. And as I said, it does address the challenges that are stated in reports that we as government have received and are acting on. This is wraparound, this is collaborative, it is patient-centered, it is interdisciplinary. We believe that this will make a difference. We believe that it will help people to turn the corner. In some cases, this can save lives. We're proud to be advancing this meaningful action which will provide Manitobans suffering from acute drug or alcohol intoxication with the help they need from highly specialized clinical professionals in a safe setting. Our government recognizes the need for enhanced support for mental health and addictions. This initiative reflects our commitment to providing that needed support. Thank you very much.
Thank you very much, Cameron, for that important announcement. I just want to add from my perspective as the Minister of Justice, this is something that we've talked about for some time now. It's so exciting to actually see this particular announcement come today. I know it's a real important piece of our continuum of care that we're trying to design here in Manitoba. Happy to see Inspector Max Waddell join us this morning from Winnipeg Police Service. I know Max and his team are doing great work here in the city, and I know this will be very important for not just the Winnipeg Police Service, but for other law enforcement teams across the province. We want to ensure that obviously people are safe, the employees are safe, and obviously we want to make sure that our police officers are getting back to the front lines where we really want them to do the good work that they are doing. So thanks Superintendent Waddell for joining us this morning. Please pass on our best wishes for all your members and for their safety. So thanks again. So with that, I want to introduce to you Dr. Sareen. Dr. Sareen is a mental health lead for Shared Health. Dr. Sareen.
Thank you, Minister Cullen, Minister Friesen, Ben Fry, Ronan Seagrave, Dr. Sokal, and colleagues. It is a pleasure to be here on behalf of Shared Health to discuss the importance of today's announcement. The 2018 Virgo report documented the high levels of mental health and substance use problems in Manitoba. The authors of the Virgo report provided a comprehensive and bold roadmap for improving the Manitoba mental health and addiction system. As described by Minister Friesen, there have been numerous investments in the mental health system based on the Virgo recommendations. Today's investments respond to Virgo recommendations 2.8 and 2.9. Expand focus of medical detox at Health Sciences Centre beyond its current exclusive emphasis on alcohol and opioids. Increase stabilization services for people in crisis due to crystal meth use. Over the last 4 years, the presence of meth-associated psychosis in our community has resulted in a steadily increasing number of patients arriving at hospital with police and paramedics who require a short period of stabilization. Although the majority of people withdraw from substances within 12 to 24 hours, some have prolonged withdrawal periods that can last for several days and require a safe place to stabilize. The unique needs of this vulnerable population requires a multidisciplinary team with a high level of expertise to ensure the safety of patients, staff, and the community. I want to remind the public that the RAM clinics located across the province are an excellent low-barrier option for people to access addiction care without an appointment or referral, because most people do not require emergency department care. With today's new investment, evening and weekend on-site physicians and psychiatrists with addiction training will work together with the emergency physician to provide timely assessment and initiate appropriate treatment for people presenting to the emergency department with substance use related to mental health and physical health concerns. The 6 additional mental health reassessment beds that will be actually located at Psych Health Centre will assist clients to detoxify from substances in a safe environment instead of a busy emergency department. We expect that there will be reductions in waiting times for assessment, as well as the length of stay in emergency departments for people with substance use difficulties. We also expect that the clients will be supported and connected to evidence-based medications and psychosocial treatments to help reduce substance use. In closing, I'd like to thank the numerous people that have been engaged in designing this important initiative. I look forward to implementing and evaluating the outcomes related to this investment. Thank you for your attention.
Thank you very much, Doctor, and appreciate you explaining the benefits of this announcement today. And clearly, we're on the right path. More investments to come, but we're clearly headed in the right direction. So that will end the formal presentations this morning. But Dr. Sareen, Dr. Sokal is going to join us, and Minister Friesen will now address any questions you may have.
These are new positions. Well, we've got some people will have information here. I can tell you when it comes to the nurses, I believe there's at least 8 positions being hired with the psychiatric nurses as well. Doctors, new doctors will be hired or extended in their hours to be able to fill those gaps on weekends and evenings. And then, of course, new security positions as well. And as well, don't forget that then we have these AFM workers, Addictions Foundation of Manitoba, social workers who are coming alongside both in the emergency department and on the inpatient part of this to be able to assist, to provide guidance, to connect people to services. So it's really a wraparound approach that's bringing the right resources and the right expertise, but putting them around the patient.
So it'll make a big difference as far as reducing the waiting times that people are waiting for assessment right now. So when there's a high volume of patients in the emergency room, this will add additional resources so that patients don't have to wait as long. As well, we can then also transfer them quickly onto the psych health unit where there's where these reassessment beds, they can actually have a safer place. And have the appropriate supports. So in addition to there are in adult mental health beds, I can't remember the exact number, but it's around 100 beds. So we're adding about 6 more beds to that capacity. We think that the 6 beds should, based on the volumes, and that should be quite helpful as far as reduce. We think it will be adequate, but of course we're going to evaluate as we go, and the volumes really could increase as far as presentations in the future. So we'll continue to evaluate what the capacity is and monitor. Right now, the estimated timeline is end of November 2020. This specific investment is focused on stabilization during the crisis. Yeah. Well, the I think they are general mental health beds, so they will have, rather than the person having to wait in the emergency room and detoxify, they would actually have a safer, quieter place where they have the appropriate supports. Usually, especially with crystal meth, people can, the withdrawal can last for 3 or 4 days, sometimes longer. So if the person stabilizes, they can be discharged into the community. If they have longer periods of psychosis, they would then be directed into beds as well. I don't know if Dr. Sokal, would you like to add anything to the experience of the patients?
I think for the department it'll be a very significant impact. The department, when it opened in 2007, was designed for 40,000 patients, and we were at 72,000 last year. We're obviously a hub site for emergency psychiatry and addictions, and our volumes have been increasing year after year, and the types of patients can often be violent and agitated, and that impacts obviously all patient volumes and staff. Our department only has 3 secure rooms right now, and the capacity is limited. So with these resources, moving these patients out of the department, it creates capacity for new patients who arrives, creates a safer environment for patients and the staff, and overall will improve the flow through the emergency department. Yeah. Yeah. We're certainly using the mental health interview rooms and the secure rooms continuously throughout the day, and the patient volumes go into the other streams, the medical surgical spaces. And as last night I was working, I had 2 such patients in our main unit. So the hope is that this will move these patients out of those streams and allow us to deliver care across all the patient volumes. Well, we project likely about a 6% improvement in wait times overall. We know from previous interventions that when you look at one stream of patients, it impacts every stream. So I think it will have an overall impact.
Well, the long-term plan for Manitoba, as we've spelled it out, is spelled out in our provincial clinical and preventative services plan. It is a comprehensive plan to be able to build better services closer to home, including diagnostic, including other parts of a patient's journey, using telehealth and technology more effectively. We've said that too much care happens in Winnipeg for people not from Winnipeg. Too much time is spent traveling on the highway, and too little efficiency exists in our system. So I would want the people of Roblin and Shoal Lake and Russell to know that we're completely committed to that plan that we have described for the last 2 years, a plan that was built with hundreds of medical leaders across this province. I know that today there's a lot of questions in Shoal Lake and Roblin and Russell. I know that that people are feeling that somehow those services won't be there for them. What I want those people to know today is that incredible efforts are going on behind the scenes to address these issues that have been have happened simply because of the confluence of certain events, certain retirements, some people moving to where they want to practice, a few maternity leaves. They have an impact on diagnostic services. and unfortunately it all happened at once. I have asked Shared Health and Prairie Mountain Health to redouble their efforts to post those positions, to fill those positions, and to get services back on track as quickly as possible. I do not believe that's accurate. I've had meetings as recently as 2 days ago with system leaders at Shared Health who talk about the enormous efforts that they undertake to hire into these positions. We must understand that when it comes to people who have this expertise in diagnostics, technicians and otherwise, we need more people. And we need to do more, broadly speaking, across the country to train and then to retain and attract these individuals to positions. So that work is underway, but I don't think that anyone should reflect on the efforts of Shared Health and Diagnostic Services to be able to recruit into these positions. I know of some very significant actions that are being taken to post, to interview, and to place, but it's a competitive marketplace out there. So more must be done clearly. We're committed to that work. I'm very disappointed that these services have to be curtailed in the interim, but people should have the absolute confidence that this government understands that these services, we're working hard to restore these services. I'm disappointed to have opposition parties trying to advance their political interests by visiting these communities, agitating the individuals, and trying to somehow say that this is a Trojan horse and it is some kind of bad plan that the government has for health care. If those opposition members wanted to spend their time more wisely, they should read that clinical and preventative plan report that clearly spells out that this is a plan for better health care sooner for all Manitobans with significant investments in rural, in northern Manitoba. It's not a plan for worse health care. We had that in the past. This is a plan for better health care. This is a hiccup, but I want to be clear. I don't want to dismiss this. For the people who live in this area, this is a big question they're asking today, and we want them to know that the government will be there to work hard to hire back into those positions. I would say that nothing is off the table, that we're even seeing real creativity being expressed by the communities themselves who are helping to solicit for positions. I think that more than anything, what is disappointing in this is the surprise that this was for the community. The communities don't want to be surprised in this way. The minister doesn't want to be surprised in this way. And I think that we're working hard to understand why notice wasn't able to be provided. There are answers we need to have in that respect. But I think beyond that surprise, I know that people are hard at work to fill those positions, and we're turning over every stone to make sure that every effort's being made. Thanks, everyone. Well, if you can see in your backgrounder, we've had an enormous effort already underway in terms of long-term, short-term, and interventional supports that are improving how we respond to addictions. Keep in mind, we've made multiple announcements, including at Addictions Foundation of Manitoba, to expand the number of treatment beds. We've expanded treatment beds elsewhere at behavioral health. The mobile, flexible beds that we've created are helping also to bring these resources to people where they live, and those are really methamphetamine appropriate treatment modalities. So we're very excited about those things, but this is about not just getting one thing right, it's getting the linkages right. So we need to have a place for people to go. We need to have places for people to go after treatment. We need places like at Health Sciences Centre where people can stabilize if they're exhibiting psychosis. There are many things we need along the continuum of care, and we're pleased as a government to have already made almost $40 million of announcements and investments in the last 11 months. And I'm just going to flag Catherine Gerard because she always stands in the back, but Catherine Gerard over there, give us a wave, actually works at Priorities and Planning committee in the province of Manitoba and the government, and she has been one of the people who has been charged with this responsibility of building these better linkages, and I want to thank her for her enormous efforts. And I see a number of people here today who have joined us, and while we don't have time to mention everyone's name, others alluded to the fact that it's been enormous work that has been performed by a broad group of people who care deeply and have the expertise, and we know that these announcements and these investments will make a difference. Yeah, so we're always concerned. We know that it's a pandemic, and we know that the pandemic does not make it easy on people. It doesn't make it easy on people who also suffer from addictions. And so we are aware and concerned about what we're seeing as the increase of overdose in Manitoba. And so we're taking action. As I mentioned, just recently we expanded the ability for Manitobans to have access to these take-home Naloxone kits. We are thinking about other ways that we can respond. We are taking advice from our experts in the field, and of course, on a daily basis, many people on the front line are involved in the continual delivery of services to the Manitobans who need them. Thanks everyone for joining us.